Hi, everybody. As you know, we just completed our Joint Commission Stroke certification, recertification, and did an excellent job with everything. I just want to say thank you again to everyone who worked hard to make sure that our charts looked good, and to the people who spoke to our surveyors while they were here, a great big thank you. We did identify some issues, though, that we do need to correct, and that is mainly documentation. It's actually entirely documentation. We do an excellent job taking care of our stroke patients. We just need to make sure that our documentation is matching what we're doing for our patients. So we have a new process that everybody needs to be aware of. Our ICU stroke checklist is something that we've had as a resource that you can use, but now it's going to become something that we have to use on every stroke patient. We have updated the stroke checklist a little bit. And so it's going to be important when you receive a patient either from the ER or from the floor, or if one of our patients has a code stroke while they're in hospital, that we get the ICU stroke checklist and we start completing this on our patient. The first thing on the checklist is going to indicate that we need to do a bedside swallow assessment, and so that needs to be done on every patient. Usually they'll do it in the ER, but we need to check and make sure it was done in the ER. And if the patient fails that bedside swallow assessment, then we need to wait for speech therapy to come and do a formal evaluation of the patient. Please don't complete a second swallow eval. We want to wait for speech therapy to do that in those cases. Just a reminder, aspirin by day 2 is an important part of the stroke measure. So if your patient is NPO because they're failing their swallow eval, we need to make sure that we get that aspirin ordered PR for our patients. Then for all stroke patients, our vital signs and neuro checks are very important, that we're monitoring our patient's condition. Please make sure that we are completing those when we are supposed to be. It's on the stroke checklist. And a couple of things we learned. First of all, please don't document patient was sleeping, anything like that. We need to do these neuro checks. So please make sure that they're done that way. And then the other area where we had a little bit of a fallout is when a patient went to MRI, we documented that the patient was off the floor. We need to actually document the vital signs. So we send our patients on transport monitors. We might just need to write down that vital sign set and enter it manually when we get back. And then finally, the last thing that I wanted to mention to you guys is about documenting our patient, family, education, and the individualized risk factors for stroke. That needs to be done at least once per stay. So please be checking in your patient's education tab to make sure that they have received that. And if they haven't, please go over it with them. And now Alicia is going to show us where to document some of these things.
Okay, for your vital sign tab, we're going to go to the flow sheet first because you're able to see what was done on your patient. So if you admit a patient from the ER or from the floor, or if they are a code stroke on our floor, you can scroll through here and see if a swallow evaluation has been done or if an NIH stroke scale has been done. To document your neuro assessments and what is required, you have to go to your complex assessment. So you're under your flow sheets right here. You're going to go to your complex assessments and you're going to go under neuro, and this has to be filled out in its entirety. Okay, along with your neuro check, you have to have corresponding vital signs at that time. So they have to be Q15, Q30. They have to be done on the minute. If you're going to be late, it's better to be early, so they have to be done within the designated time frame. Also, for education, what Mary was talking about, you're going to click on your education tab. So stroke is documented in here, so you're going to flag down your stroke. So there's personal risk factors for stroke right here. So you're going to click on here under your personal risk factor. You're going to gonna click right in here. Right in here. And you're gonna chart on it. So you're gonna make a comment. I'm gonna uncheck all these, sorry. I wanna just check this one. So I am going to add a comment right here, and this nurse has already taken care of it. And so risk factors for stroke are age, smoking, and hypertension. So all that was already documented, so you know that that's completed. They're also going to receive a stroke booklet that we'll give them when they get admitted to our unit if they haven't already received one.
Perfect. Thank you, Alicia. So just a reminder now for our stroke patients, we do need to use the ICU stroke checklist. It will guide us for everything that we need to be documenting. And then at the bottom of the checklist, there's going to be an area for the transferring or discharge RN to sign, as well as our team lead or charge nurse. And then if you could please place that in my inbox or Alicia's inbox, we will keep track of those forms. Thank you, everybody.
Thank you.